Thank you, Mr. Williams, and a pleasant good afternoon to everyone. Today, May 12th, I'm going to be presenting the Health Emergency Operating Center's situation report using the PowerPoint format. Today is International Nurses Day, and we all join in saluting all the nurses here in the Federation of St. Kitts and Nevis. Now, it was on March 11th that the World Health Organization declared the coronavirus disease outbreak as a pandemic. And since then, the virus has infected 4,098,018 confirmed cases, and it has killed over 283,000 persons globally. This virus has caused unprecedented changes to date, changes in the way courts operate, changes in the way we praise and worship. Now, just this morning, the COVID-19 task force would have spent almost 3 hours in dialogue with the faith-based leaders here in St. Kitts and in Nevis. And the purpose of this meeting was to discuss and determine what would be the new norm in terms of church and worship going forward. To date, the Ministry of Health would have tested 334 persons. We've just had 15 confirmed cases to date. 318 results would have returned negative, and today we only have one result pending. It's now about 23 days since we would have last announced a case, our 15th case. We have 11 cases St. Kitts, 4 cases confirmed Nevis. Today, we have 52 persons quarantined in a government-assigned facility, and we have 2 persons quarantined at home. We have 1 case remaining. That individual is isolated, and to date, we have 760 persons who would have been released from quarantine. This slide just highlights the Ministry of Health's protocol with respect to quarantine and testing. And so if perchance an individual, a national, returns to the Federation after submitting a written request and after approval would have been granted, that individual automatically goes into quarantine in a government-assigned facility, and they would remain in quarantine for at least 14 days. They are not tested immediately upon arrival in the Federation, or they are not tested, upon arrival into the quarantine facility. They are tested on day 14 of quarantine. That individual would be released from quarantine if they remain symptom-free, and if their COVID-19 RT-PCR tests would have returned negative. I also want to underscore that this protocol is not new, and this has been in vogue for a couple of weeks now. Let's, go back to when the Cuban contingent came into country. They remained in quarantine for 14 days, I think even a little beyond 14 days. They were sampled and tested on day 14 of quarantine. Okay, so to date, we have 14 persons who would have recovered, 10 St. Kitts and 4 on Nevis. And I keep saying that the average duration of time between diagnosis and recovery stands at approximately 30 days. All right, and so we have been successful in containing the first wave of infections, and we've achieved this through a comprehensive COVID-19 operational response endeavor. And the team, the health team, have all contributed, and we are happy to note that we have been successful in containing the first wave of COVID-19 infections. And today, International Nurses Day, I want to salute all the nurses within the Federation. On behalf of myself and the Ministry of Health, we want to wish all the nurses a very happy International Nurses Day. We want to thank you for the care and your contribution to healthcare within the Federation. Thank you, thank you, thank you.